Good evening. Since the 1990s, opiate misuse, whether through overprescribing or illegal use, has led to addiction, death, job losses, which has affected many individuals, their families, states across the United States. In response to the growing rise of opiate use, lawmakers across the country have utilized innovative policies to stem the opiate tide. The Centers of Disease Control and Prevention, the CDC, has responded to the opiate crisis by releasing the guidelines for prescribing opiates for chronic pain, which is evidence-based and completely voluntary for clinicians prescribing opiates to patients. State lawmakers have used the CDC guidelines to formulate policies in the hopes of fighting the opioid epidemic. One mandate the policy makers have used is implementing as limiting opiate prescription. In 2016, Massachusetts was the first state to pass laws which, one, set a 7-day supply limit for first-time opiate prescriptions. Some states quickly followed the trend of limiting opiate prescription policies well into 2017. However, limits to opiate prescriptions have not been limited to adults, but some states have included opiate prescriptions concerning minors with additional information supplied to guardians and parents concerning the addictive properties of opiates. Other states not only included limiting opiate prescriptions, but incorporated guideline criteria into law in prescribing the lowest possible effective doses of opiates of a quality not greater than needed for pain management. One tool that has proven beneficial is the Prescription Drug Monitoring Program, or PDMPs, which is an electronic database that tracks controlled substances prescriptions in the state. PDMPs have helped health authorities such as local and state public health departments, pharmacies, and clinicians track timely information, including 1, prescription histories of opiates and other controlled substances, 2, patient behaviors, 3, data showing hotspots of opiate epidemics or outbreaks, and 4, provide data to help facilitate a response to those outbreaks. The downside of the PDMPs is whether the information is entered into the system in a timely fashion, or if that prescribers or clinicians actually access the database and use the information. North Carolina's PDMP system is known as the North Carolina Controlled Substance Reporting System, or CSRS, which, 1, collects information on dispensing controlled substances prescribed, and 2, makes information available to prescribers and dispensers. The North Carolina Department of Health and Human Resources has partnered with health systems throughout North Carolina to integrate the CSRS as part of a clinical workforce known as the PMP Gateway. The PMP Gateway is a web service which provides 1, automated multi-state queries to integrate patient controlled substances prescribing histories with the electronic health records and the pharmacy management system, and 2, facilitates, communicates, information, transfers, and support of state-approved and ERH vendor development processes. And 3, developed products with analytical and clinical resources for risk assessments and patient support. The group I represent, the North Carolina Women Against Opiate Misuse, or NCWAOM, are engaged in state monitoring of state policies which affect individuals, families, and communities suffering from the opioid epidemic. The organization closely monitors state and local policies for effectiveness, operational functionality, as well as measurable health outcomes and referrals. In the past, substance control was basically a criminal offense, but pressure from the health communities and interest groups like the NCWAOM have convinced lawmakers that drug addiction is better served by health officials rather than law enforcement. One of our goals is sponsored by the NCWAOM is the use of naloxone, which prevents opiate overdoses, and the ability of law enforcement and first responders to be trained in administering and carrying naloxone as a preventative measure. Other goals are to help aid clinicians in the use of PDMPs and the importance of timely assessing of the information provided in helping patients and their families cope with opiate addiction. And lastly, a primary goal is to aid pharmacies in entering opiate and substance control drugs into prescriptions into the PDMP database in a timely fashion. The NCWAOM supports all statewide endeavors in the battle of opiate addiction and the rising epidemic. Thank you.